My name's Marvin. I'm 44 years old, and for me right now, to get health insurance is pretty impossible.
When an individual finally screws up the courage to go to a safety net clinic, many times they have a complex illness. They haven't been able to go to the clinic because they have work obligations and childcare obligations and transportation challenges and language barriers and fear.
When the chest pain started, they weren't that bad. I just had to keep working. The pain got so intense, there's a point where I just don't know what happened. And the next thing I know, I was in the emergency room. The doctor told me I had a heart attack.
For your average person, it's hard enough to get access to specialty care. If you're a patient at a safety net clinic, 30 million people plus, it can take you months.
I left that hospital with tons of medication that I can't afford. I have to somehow figure out how I can see a cardiologist. I have to just hope that I'm okay.
So when they finally go to the clinic, they'll see a primary care provider. Now, many of these providers are completely culturally competent. They work in a community in which they grew up, but they often lack the medical expertise.
MAVEN Project was using telehealth technology before it became popular, all designed to meet the needs of safety net clinic providers.
Being able to reach out to the service in between patients, sometimes within the same day, be able to call that patient up again and say, hey, this is what the plan is.
We now enable access to over 2.5 million patients through our portal.
What's really great and unique about MAVEN is the caliber of the doctors and specialty care provider they have.
These world-class specialists can actually work with primary care providers in safety net clinics and give them top-of-the-line, best-in-class advice.
It isn't just a one-time consult. You are able to reply back and forth about this patient's care as much as needed.
The doctors at the free clinic were able to connect with a specialist. And within a few days, I had a solution, a treatment that actually fit my budget.
That patient can walk out re-energized with hope and with a plan of action to deal with their symptoms, to deal with their diagnoses.
Like I say, it saves lives every day.
We need all the help we can get.
So many exciting things have happened to date, and there are so many exciting things in our future.
My goal for the MAVEN Project is to be able to reach every safety net clinic in this country.
If I didn't find this clinic, if they could not connect to a specialist, I do not know where I would be today.